Doing it for this country because we suffered with Obamacare. I went through 2 years of campaigning, and I'm telling you, no matter where I went, people were suffering so badly with the ravages of Obamacare. And I will say this, that
I'm a dick.
As far as I'm concerned, your premiums, they're going to start to come down. We're going to get this passed through the Senate. I feel so confident. Your deductibles, when it comes to deductibles, they were so ridiculous that nobody got to use their current plan, this non-existent plan that I heard so many wonderful things about over the last 3 or 4 days after that. I mean, I don't think you're going to hear so much right now. The insurance companies are fleeing. It's been a catastrophe, and this is a great plan. I actually think it will get even better, and this is, make no mistake, this is a repeal and a replace of Obamacare. Make no mistake about it.
Absolutely.
Wrong.
True.
Make no mistake.
What is up, everybody? Yes, I am back from my long hiatus. I have finished my sophomore year of college, and I am ready to get back to making some new videos for you guys. In today's video, I plan on addressing some of the biggest news we've seen in the last week, and that is healthcare. I want to address the American Health Care Act, and I want to bring up some of the misconceptions some people have about it, and also speak about how it's different from the Affordable Care Act. So first off, it is important to distinguish what is different between the American Health Care Act and Obamacare. Spoiler alert, it's not that different. So some of the key things that's changing, it's going to be the employer mandate and penalties for not insuring employers who work more than 30 hours a week at companies with more than 50 employees are repealed. The individual mandate and penalties for not having insurance are repealed. Obamacare's expansion of Medicaid will effectively be reversed in 2020 when the federal government stops funding it. States that have not already expanded would not be allowed to do so starting immediately. And many of the Obamacare taxes are being repealed as well. So those are some of the core changes that it's making. But what about the things that it's actually keeping from Obamacare? Those things are people with pre-existing conditions cannot be denied coverage. This measure would provide states with federal funds to help set up high-risk pools to provide insurance to the sickest patients and to help those with pre-existing conditions pay for insurance. Dependents can still stay on their parents' plan until the age of 26. Insurers are still prohibited from setting annual and lifetime limits on individual coverage. The Cadillac tax on generous healthcare plans will remain, but be postponed from 2020 to 2025. And current Medicaid enrollees will be grandfathered in when the federal government stops providing the extra federal funds that allow for expansion in 2020. Now hold up. Rewind that a few seconds. People with pre-existing conditions cannot be denied coverage. So the claim that insurance companies have to now deny everybody with a pre-existing condition, which is the thing that literally just about everybody has been harping on for the last week, is actually a false claim? Huh, that's interesting. I mean, who knew that the left would come up with false narratives to scare people? Oh my god! The pre-existing condition thing is something I've had to explain to several people so many times at this point, and it just doesn't seem to be getting through to people what the actual problem with pre-existing conditions is. So, let's understand why we have a pre-existing conditions problem in the first place. Back around World War II, the government put a freeze on wages so that companies could not increase salaries for workers to extend to a certain point. So in order to attract workers to come for companies, people would start offering fringe benefits. And one of those things was actually healthcare, health insurance. So now if we fast forward to today, most people, over 85%, get their health insurance through their employer. So ultimately, this created a pre-existing conditions problem because anytime somebody lost their job or got fired or for whatever reason no longer had a job, and in between that period of getting a new job and losing their job, if they got sick, they now had a pre-existing condition and couldn't be covered by health insurance companies. So how do we fix this problem? Thanks for asking. I'm gonna tell you. The obvious solution is to untangle health insurance from employment. You should not have to have employment to get health insurance. In fact, it shouldn't be like that at all. This will ultimately bring down costs of health care, because health care and health insurance are not the same thing. Health care is the services that are provided by doctors and nurses and hospitals and the things that they do. Health insurance is just the arbitrary third party that pays for your health care. And this is a problem because they used to be cheap. Healthcare services used to be relatively cheap and people paid out of pocket for them, but now everybody's going to just routine doctor services through their health insurance, and that's why costs are crazy high. See, people have no incentive to shop around for the lowest cost healthcare because their insurance company covers it, so they're like, oh, I don't know what this costs, I'm just gonna go in and just do the service because I'm not paying for it. And so this creates a problem because then healthcare providers can charge whatever they want. I mean, have you ever looked at a hospital bill after going to the hospital? They pay out of your mind expenses for the simplest things that you would never in a million years pay another place. It's like going to a restaurant and then not being allowed to look at the prices on the menu, getting your food, and then they charge you whatever they feel like. It makes absolutely no sense, and it's not how any other market works. So back to the pre-existing conditions thing. So what Obamacare did was it made it illegal for insurance companies to discriminate based on people's pre-existing conditions, and they had to pay the same price for their health insurance no matter what. Now, of course, this created a problem because this just incentivizes people to not buy insurance at all until they get sick, because it would save them costs in the long run, and because they can't get charged extra for now being sick, then they pay the same price as everybody else. So ultimately, you have healthy people who are buying insurance beforehand and being responsible, paying for the people who didn't buy insurance when they were totally healthy and just waited until they got sick. And this, of course, makes it actually harder for people with actual pre-existing conditions and who actually have illnesses to get insurance because it creates a false demand and there are less people providing these services for them, and it makes it more expensive for their services. And so that's why premiums and deductibles are up over 100%, 150% in some states. It's insane. People can't afford these prices because they have to keep passing these extra costs onto their customers. See, the thing about this insurance thing is like if I had a car and then I set it on fire and then I went to the insurance company and asked them to insure my car, even though it was already on fire and for no extra cost. They would never in a million years take that claim. They would think I was crazy and they would never pay for that. But that is how health insurance currently works. Healthy people who otherwise should have no problem going to the doctor are waiting until they get sick and then having somebody else foot the bill. That is ultimately what is happening. Now, does the American Health Care Act fix this problem? Not exactly. The plan from this bill was to create high-risk pools for people with pre-existing conditions and these problems to be able to pool together their funds and get some funding to the states from the federal level in order to increase their buying power as a collective and reduce costs for that entire group of people. And this is a pretty good plan, and I think it's better than Obamacare's initiative, which simply forced everybody to get insurance or be fined if they didn't, which was ridiculous. Now, I don't think it's perfect, but I do think it is better. The thing is, it was never supposed to help regular healthy people who otherwise would not need the insurance covered all the time. Regular healthy people should be able to go to the doctor on a routine visit and pay for it out of pocket. It shouldn't have to come for their insurance. Insurance is supposed to cover only the huge calamities like getting cancer or some other incredibly terrible illness. But of course, if you listen to the mainstream media, they'll have you believe that under Obamacare, nobody ever died. Nobody ever got sick. Nobody's premiums went up. It was perfect. It was a fantasy land with unicorns and everyone was immortal. But that's simply just not true at all in any way. And they'll also have you believe that the American Health Care Act, now it just makes everybody who has ever been sick in any way a pre-existing condition. I mean, they literally said that rape or a C-section was a pre-existing condition. Seriously. 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 However, Ben Shapiro breaks down this fallacy very simply in his article on the Daily Wire. He says, according to the leftist media, if you suffer an injury in a terrible situation, the situation itself is now a pre-existing condition. In other words, these headlines could have just easily read, in Trump's America, car crashes are a pre-existing condition. Or, under the new healthcare bill, soccer accidents could be a pre-existing condition. The bill itself says that pre-existing conditions are pre-existing conditions. Nowhere does it give a list of pre-existing conditions, including rape or sexual assault, because these are activities leading to injury, not actual injuries. The leftist case here is idiotic. Events are not pre-existing conditions. Injuries that occur as a result of events, if they occur before you attempt to buy insurance, are definitely pre-existing conditions. Duh. But the debate has now been so skewed that we think the government can magically make health insurance cover rape, which doesn't even make sense. If no injury occurred requiring medical attention due to rape, what would the insurance company do to cover it? Pray? Hunt down rapists? So every argument coming from the left is literally just an appeal to emotion. There is no substantive factual backing to it at all. One of the other claims I hear constantly coming from the left is that, oh, 24 million people are gonna lose their insurance and be thrown out to the street and literally die. But what these people ignore to tell you is that it's only because under Obamacare, the Medicare expansion increased the coverage for people who were then forced into insurance. And also people who didn't buy insurance were penalized, therefore people had to buy insurance. They were literally forced to. That's why they had no choice. So yes, 24 million people were now forced into insurance, whether they wanted it or not, and whether it was good for them or not. And I'll never understand why this is so goal worthy when the fact that just because they're covered doesn't mean they're getting services. I mean, if the premiums are up 150% and they can't pay for the service, then what is the point of being covered anyways? You can't pay for it. Just because everyone needs healthcare doesn't mean the government has to subsidize it. And that's the big problem we're seeing. Good things don't have to be subsidized by the government to be provided to people. It's like bread. Bread is a good thing. Everybody needs bread to survive, but the government doesn't subsidize bread. People are still magically able to buy bread for themselves because it's cheap and affordable and accessible to everyone at stores. And yet we don't do the same thing for healthcare. The government being involved in healthcare is the problem. And socialized healthcare, single-payer healthcare, those things would never work in America. Everybody likes to point out European countries, which first of all have population sizes not even a fifth of America's population size, and they think it can work, as well as the fact that America subsidizes most of those countries' militaries. So I'd like to see how long their socialized medicine can last when we stop funding their military efforts. So if we're going to have health insurance, we have to actually make it insurance again. Allow people to purchase their own plans, keep those plans regardless of if they have a job or not, and allow themselves to buy plans that actually match their needs, not have a base set of requirements that not everybody fits into. Let consumers have the choice about what kind of healthcare they need, and not the one that the government thinks is the best for everyone. Healthcare in this country is a mess, and I don't think any one single bill will make it no longer a mess. But we need to take steps to freeing the market of healthcare and actually allow people to have choice and consumer advantage in the market again. So maybe the American Healthcare Act is a start. Or maybe it's just another spiral down a long lane of government-run healthcare and it will be terrible forever. Who knows? Anyway, that's it for this video, guys. I hope this cleared up some of the fear-mongering and misconceptions people have been throwing at you for the last week or so. But till next time, see ya!